All right. Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller, and today we have Dr. Reham Sadek. Welcome to the podcast.
Thank you so much. Thank you for having me.
Yes, I'm so excited to hear all about what you do and everything. So tell us a little bit about basically who you are and what you do. And I think you're in Sarasota, right?
No, I'm actually in Tampa. I'm in Kerry.
Tampa. Okay.
Yes.
Great. Okay.
Yeah.
All right. So tell us a little about who you are and what you do.
Okay. So I am a board certified psychiatrist. I specialize in children and adolescents, but I'm also an adult psychiatrist, so I do both. And I'm working on getting my board certification in obesity medicine as well. And I'm also a publisher. I'm a wife, I am a mom, I'm a lot of things. So, but professionally, a psychiatrist, children, adolescents, and adults. I do inpatient and I do also have a private practice on the side. So I do both inpatient and outpatient.
You're definitely staying really busy. And obviously, we're going to talk about it, the publishing part, but you're a busy person. That's wonderful. And did you trained in Tampa as well, partially?
So I graduated medical school in Egypt, Cairo
Okay.
University, and then I did my residency in Chicago, Chicago Medical School, and then I came to Florida, and this is where the link to Florida, to do a fellowship at USF for children adolescent psychiatry. So
Okay.
this is where I did my child training. And then I had it in mind that I'm going to stay in Florida and I'm never moving. So I
Yeah.
stayed, yeah.
Awesome. Well, I'm so glad you ended up here. That's wonderful. So we were going to talk about understanding basically ADHD and what ADHD is. What is it really? How does it differ from typical childhood behaviors?
Wow. Okay. So I have a passion for ADHD. I love ADHD. And I tell you, most child psychiatrists do for a simple reason that we doctors typically love what we can fix. I'm sure you can relate to that. So any illness that has streamlined, fairly easy, simple, straightforward treatment, we love because we feel like we can make a lot of difference. We can help a lot of people. So, what ADHD is a neuropsychiatric disorder, which means it's a disorder of the brain that has behavioral component to it or behavioral manifestations. So, the illness itself happens here in the brain, but the manifestations include a lot of things. Part of it is behavior, part of it is mood, part of it is sleep. So it's a lot of things in ADHD. The common mistake that we make is kind of like stigmatize and say, oh, he's just a bad kid, or he's just a hyper kid, or not well behaved, or it's just poor parenting, and we blame the parents. And that's really not accurate at all. So ADHD starts in the brain, but it manifests in many ways.
So what does it stand for, and why did we had previously called it ADD?
So ADHD is attention deficit hyperactivity disorder. We used to separate and call it ADD, which was without the hyperactive part, so attention deficit disorder. But the DSM changed the name for whatever reason, and they just removed the ADD, and now it became attention deficit hyperactivity disorder as a one umbrella, but there are subtypes to it. So there is one type that kind of like focuses on inattention alone, hyperactivity alone, or both together.
You have no idea why they changed it.
I don't have a clear idea of why. I believe they just kind of like felt the hyperactivity is a, I don't want to speak for them, of course, but the hyperactivity is a major component, even if it's
Yeah.
not, and we see this clinically in ADHD children and adults. The hyperactivity may not manifest in the I am moving a lot or jumping around or climbing the walls, but it's on the inside. So I am sitting, but I'm fidgeting, or my thoughts are so scattered and going all over the place. So it's kind of like innate. And you hear that from patients a lot. So I guess that's the reason, but it's the illness itself, the pathology itself did not really change. It's just the name. And this is a common thing with DSM. If you look at DSM 2 or 3 or 4 or 5, completely different naming and different
Yeah.
organization. I don't think schizophrenia changed. I don't think OCD changed. Illness is the illness, it's just naming.
Right. And DSM is the criteria that the big book of what
It's
we
the
reference
manual,
for
yes, the
the
statistical
psychiatry.
manual that kind of
Mhm.
gives us the criteria to diagnose mental illnesses, because mental illness is very subjective. You
Mhm.
come to talk to the patient tells you how they feel. So I could be listening to the same patient, and based on what they tell me, I would give a specific diagnosis, and then comes the next psychiatrist and listen to the same patient and give a different diagnosis. So we
Mhm.
wanted to avoid that and have it more like unified. So when two psychiatrists interview the same patient, they will come up with fairly close, if not the same diagnosis. So that is why we have a criteria and we have a manual we go by.
Okay. Yeah. So what are some of the most common signs or symptoms that, parents should look out for?
For ADHD.
Mhm.
So think about the name. It's the simplest way to remember. It's the hyperactivity and the inattention. With the hyperactivity, it's just someone who cannot sit still, very hyper, moving a lot, have that urge to move, and sometimes the movement are not purposeful. So the person would be going back and forth, repeating the same thing, going from one chair to the next without really a reason. And also, when you're sitting down, you're fidgeting, you're tapping your foot or moving your fingers or doing something. You gotta be doing something all the time. And the typical rambunctious, all over the place kid. So
Mhm.
that's for the hyperactivity. The inattention, again, the name explains it. Someone who's inattentive, cannot pay attention, cannot sustain attention, especially on tasks that require mental effort. So they can focus on a video game or watching a YouTube video or doing something that's interesting to them or easy or doesn't require them to focus or do something. But when it comes to doing a math problem that requires really sustained attention, really focusing, they have a problem with that. And that's an important distinction because I hear it all the time from parents when they say, I don't think my kid has an attention because they can sit for hours and play video games. It's not that. You don't measure it based on their ability to do an easy task that doesn't require them to do anything. They're just on the receptive side. But when it comes to actually actively doing something that requires attention, then they start to struggle.
Mhm.
And then also with that comes the forgetfulness, the losing things, the misplacing things, doing the homework and forgetting to turn it in, even though they did it, and so on.
So you're kind of bringing up the points without saying it also is one of the parts of how you evaluate, right, is looking at the home life, right, and looking at the school life or something like that, right?
Absolutely. In order to make officially the diagnosis, these manifestations have to be present in at least two different settings. Usually it's home and school, but it could be, I mean, if someone is homeschooled, it would be home and somewhere else, maybe the playground or maybe church or something like that. There's
Mhm.
also another, so psychiatrists, we always think about illnesses beyond the DSM-4. Okay, and a good, well-trained psychiatrist always does that. So when you think about ADHD, you look at the criteria of the DSM, but there are things that we know exist in ADHD that are not specifically listed there as one of the criteria. And sometimes that's a source of confusion. For example, impulsivity. So impulsivity could be shared between many mental illnesses, for example, bipolar disorder. So impulsivity is really a huge component of ADHD because these kids are often very quick to act before they think, which
Mhm.
if you think about it, it could be part of the hyperactivity. It's almost like your brain is moving faster than you can control or think about. So, and then there is a mood component. A lot of times kids come because the mood instability is the problem. They're just very irritable. You can't talk to them. Nobody can talk to them. They get angry so quickly, and that kind of manifests in many ways. And then that would be like the main problem that they're coming for. And a lot of times people confuse this, or is it depression with the irritability? Is it bipolar? Is it something else? But you have to keep in mind that ADHD in itself has a lot of mood components.
Are there any different presentations with like girls and boys?
Girls tend to have more of the inattentive, and which is why they don't get diagnosed early on as much as boys do. Boys tend to have the hyperactivity part more often and the impulsivity part more often. So because they are destructive to the environment because of the hyperactivity, they get noticed, they get sent to get an evaluation, so they are diagnosed earlier. The girls tended to be sitting in the back of the classroom, daydreaming and not paying attention, but she's not disrupting anybody. She's not annoying to anybody. So they tended to get forgotten, and they don't get diagnosed as early as really we should or we would like them to.
Are there any, well, let's just put it this way, for treatment wise and stuff, why is early intervention so important for the kids?
Oh my God, don't get me started. This is one of my favorite topics to talk about with anybody really, especially with parents who always come and they have good intentions, of course. They want what's best for their kids, but they think I'm going to delay putting them on medicine as much as I can, because if they're just getting by and functioning, let them be. So there is a huge room for improvement and for education here that we doctors in general, pediatricians, primary care, and psychiatrists, of course, there's a huge room for improvement in education we can do in this area. It's very important to understand that when you have ADHD, you have an illness. Okay, there is a fundamental imbalance happening in the brain. So you have a disorder. And in order for me to help you, I have to treat you. I cannot just give you a diagnosis and send you on your way. That's not how we practice medicine. You don't give someone a diagnosis of strep throat and you tell them, goodbye, you have strep throat, see ya. You offer treatment and you offer different options. And you treat, basically. So with ADHD, if you don't treat early, there is a huge list of complications and problems that can happen down the line if you are not addressing the problem. So the big one that really scares a lot of people when I tell them about is the risk for substance abuse. So you're afraid to put your child on medication because you don't want them to get addicted to methamphetamine, methylphenidate, or amphetamine, or Adderall, or Ritalin. But then by you not treating the illness, you're actually putting them at risk for substance abuse, the real substance abuse, the marijuana and the cocaine and the methamphetamine down the line. So you have to understand that. This is just one example. So these kids, when they are not treated properly and early, first of all, think about the academic outcome. It's school is going to be very difficult. They will hate school. They have risk of not graduating, dropping out, poor grades. They never reach their potential. They could do a lot better if we have treated them. And some of them, just if it's really bad enough, by the time they can drop out, they will drop out because school is so hard. They don't want to do it. Other things, and also a huge problem with social component. So, for example, even at younger age, if these kids are annoying, rambunctious, hyper, disruptive, often the other kids don't want to play with them. So they get rejected. They don't get invited to birthday parties. Nobody wants to deal with them. Even the teacher, they're not the teacher's favorite. And they know it. The kids know it. So that creates a lot of depression and anxiety, lack of self-esteem. They feel like, what's wrong with me? And they can't control it. It's not their fault. So if we're not treating them, we're basically doing harm and basically punishing them for an illness they did not choose to have.
Well, that being said, I know we were going to talk about treatment more, but how do they, obviously they're not choosing to have this, but are there risk factors or anything that could be related to actually getting it?
Genetics is a huge part of it. So when the parents have ADHD, even if it was never diagnosed, that's a risk factor. There are risk factors related to pregnancy, smoking during pregnancy, prematurity if they're born premature. But again, genetics is the biggest risk factor.
Mm-hmm. So you mentioned like already medication to treat for ADHD in children. What about, are there any of the other alternatives, or how do you approach this?
Okay, so the main treatment for ADHD is medication. It's a chemical imbalance in the brain, and no therapy can treat it. By you talking to someone, no matter what you say or how you do it, you cannot make them focus, or you cannot make them less hyper. So the main treatment is medication. There are other things that can help. For example, ADHD, there is a huge correlation between ADHD and ODD, which is oppositional defiant disorder. That is a behavioral disorder. So treatment with therapy, such as parent-child interactive therapy, that can help with ODD because it can help the parent learn how to manage this behavior. Behavioral therapy, CBT, can help if there is depression or anxiety associated. We can help with that with therapy also. But it's very important to understand, therapy is not going to treat the ADHD itself. Mm-hmm. That has to be treated with medications, okay? Now, for older kids, preteens and teenagers and early adulthood, I often recommend getting an ADHD coach. That's not a therapist, okay? It's a coach that's going to teach you fundamental skills that you need to learn so that you can manage your own life, you can manage your own finances, you can manage how to remember things and not forgetting appointments and not forgetting to pay your bills on time and not forgetting to go places. And you would think, as a normal person who doesn't have ADHD, these tasks are easy and we just do it. There's no big deal. But for someone with ADHD, just getting organized and sitting down and finishing a task or responding to an email or booking an appointment and keeping it, it could be a huge challenge. Okay, so an ADHD coach can really be helpful in that area. And now there have been newer modalities that are coming now on the market and becoming available to patients now, not just in research setting, which is digital therapeutics. So basically that could be an app or a video game that helps these kids pay attention more and help with ADHD symptoms.
Very interesting with the app and the developments coming down the line. That's pretty cool.
Yes. Yeah.
Yeah. Are there any like big myths or misconceptions that you'd like to correct about ADHD? I think you've kind of already went over one of them.
Yeah, the biggest
the treatment.
Is they're just kids are being kids. Just let them be kids. No, you gotta look at. We all know that kids can be moving a lot. That's normal for a kid to be moving and playing and running. That's what kids do. But look at did they cross the threshold of having an issue or a problem? Is this problem interfering with my functioning, with my ability to have a normal or closest to normal life? Is it interfering with me in a social environment? Is it interfering that in the classroom I'm always being in trouble, I'm always getting called out or sent to the office or something like that? So yes, kids are kids and they will be playful and hyper to some extent, but am I within the average, within the norm for my peers from the same age, or do I have a little bit more of just, something more that crosses that threshold of having a problem or an issue? And that also, the second point is, let's just delay treatment, because delaying treatment is kind of like avoiding exposing the kids to the medication for as long as possible. That is a huge myth, because you're not exposing them to the medications, but they are being exposed to the illness every single day. So think about that. Yeah. So it's delaying. I always say delaying treatment is doing harm.
How young would you start someone on a medication?
Depending on the situation, there is really no age. And some of these medications are approved as early as age 3 years old.
Oh my gosh, wow.
So and I say this for primary care, for pediatricians, do not be scared to treat someone who's young if there is a significant enough problem that would require or warrant treatment.
Mhm. I like how you mentioned the ADHD coach. I think I've heard of this, solution, and I have some colleagues that do that, and it's just amazing how they can help
Yes.
clients, patients, whatever you want to call it,
They
to
call
really
them
be able to function better, like,
yeah.
in society and socially and in at work. It's very impressive. So I definitely agree with recommending that for sure. Yeah.
Yeah. I think it's becoming more popular now because people are finding out about it and learning more about it and hiring these coaches. And it's very helpful because they teach them skills that will stay with them for the rest of their lives.
Mm-hmm. Do you think that medication and the behavioral therapy work best together as well to be doing that?
Especially for the comorbidities, if there is an anxiety, depression, or ODD, yes, absolutely, of course.
Mm-hmm.
Of course.
Mm-hmm. Do you have any wonderful success stories from your practice that you'd like to share?
Too many to really remember, and it just makes my day when I hear a parent telling me, "Oh my God, it's day and night
Mm-hmm.
difference," and they are very, very happy and very pleased. And or when they call you and they say, "My kid got invited to a birthday for the first time," it gives me goosebumps.
Mm-hmm.
Yeah.
Yeah, it's a very stressful situation. I'm sure that you deal with this, well, in your book that we're going to talk about in a second. But, even in our, I guess, school and social circle, the other parents are, discussing about other kids when they have a problem, and they're kind of stigmatized a little bit, right? Like you said, they don't get invited to the birthday parties. They don't want them to be on that team because they don't want to have to deal with that because the kid is too rambunctious and things like that. And it is really sad that that happens. But, I think having somebody like you that they can work with and help them can really help, better their overall, I guess, upbringing and everything to make their life so much more fulfilling as well and to be included in everything. So I think it's really important to not delay treatment, basically, like you said. It's important to get in there and get help. Yeah.
It happens to the parents too, by the way, because if you have
Yes, it
a
does. Yeah.
child, you're also not going to be invited that often to someone's house or someone's party or a wedding or something like that, because they don't want to have to deal with the damage that your kid can cause. Especially these special occasions, people prepare for so much and put a lot of effort, time, and money, and they're not going to take the risk with inviting you if you have a child that could ruin the party for everyone. So,
Yeah.
so it becomes a whole family problem.
Yes, that's so
Not
true.
just,
Yeah. So you wrote this book recently,
yes, and I have the book
Parenting
here.
Kids with ADHD. Oh, perfect. You have a copy. What is the under part? I obviously haven't read it yet because it's too new.
So it's parenting kids with ADHD from frustration to fulfillment. And I really wanted to focus on this because I feel like this is really what the book offers to people. The book offers solutions. Solution that will help the kid, of course, but then also it will help the parents. And more importantly, in my opinion, it will help improve the relationship between the parent and the child. Because think about this, if you're raising your kid and all you do all day is to correct them and give them consequences and tell them what they messed up in and what they did wrong, and that's not a good relationship. You don't even have time to foster a relationship because that's all you do all day. So when you learn some techniques and some skills to help you become a calmer parent, a parent who is more in control, a parent who knows how to handle situations, who is prepared because these situations will happen. Okay. So when you have a plan, okay, if the kid does this, I know what I'm gonna do. I know how to handle it. Then you're a little bit more calm, you feel in control, then you have more time to foster your relationship with your child. And that's very important. So it's a guide to understand and support your neurodivergent child, and it offer practical strategies to improve focus, emotional regulation, like we spoke, how big part of ADHD that is, and self-control. So the book is for parents, of course. The kid is not going to read the book. The parents need to read the book. And the book is approaching it from two aspects, from an age group. So we're dividing it up from like preschool, elementary school, middle school, high school, and then also talking about how to approach it when you have different comorbidities going on. So when you have autism going on, or when you have ODD going on, or when you have anxiety or OCD, and so on.
Well, I was going to ask what inspired you to write it. I don't know if that already was part of what you said, from like kind of getting the parent in the, well,
okay. The main reason is I get asked these questions all the time. So I wanted to have a book that is a reference for parents. And the book is really, the book works, you don't have to read it in order. You can just open any chapter that you feel like, I want to read about this, I want to learn about this. And then you can do that. And then, so it's basically a reference, something you get back, you go back to and you check, what do I do in that situation? And because we get asked these questions all the time, I decided to write the book. So that was really the drive behind it.
Yeah, that makes a lot of sense. And then Eileen, how you say you can jump around and it's more of a guide, right? I think
It
that's
is, yes. So
yeah.
there is no specific order.
Is there like a certain chapter or something that you thought was kind of your favorite or strategy that you want to share?
I don't really know. No, not really. Nothing specific jumps to mind. I talk a lot about adjusting the environment at home, because a lot of times we fail these kids by not providing them the tools that they need, because we don't know what they need. We don't know. Their brain works different. We all know that their brain is wired differently. So we really don't know what goes in here, and we don't know how to help them. So I think I would say this is my favorite part in the book, talking about adjusting the environment, so that your environment at home, the area where you study, or the area where you do homework, or the area where you eat your meals, is kind of like geared towards a different child, not having a lot of distractions, having everything organized and labeled and clear, and the kid knows exactly what to expect and what they're supposed to be doing. Organizing your play area where the kid plays, it's more for younger kids, of course. And then the study part, where we do homework, and how we should organize that in a way that will help the kid and avoid issues and conflicts and problems.
How would you say in your book or in practice that you help families kind of manage these feelings of guilt, blame, burnout?
Lots of psychoeducation, a lot of just talking to them and letting them know that it's not their fault. They did not create this problem. They didn't do anything wrong. And big part of it is inherited. And if the kid got it from the parents probably got it from somebody who probably went undiagnosed and untreated. So a lot of psychoeducation, I would say this is really, I spend a lot of time doing that, especially on first appointments, especially like when I meet them for the first and second and third time. We really talk a lot. We really focus on educating them how to look at it in a different way, how to approach it in a different way. And then once we kind of get them stable and on their way, then they can manage it and they can handle it. And of course, once you introduce the medications also, and if that makes a big difference, which it does in most cases, that can also be very helpful.
Yeah. So what is one piece of advice you might give a parent who just received an ADHD diagnosis for their child?
I would say treat as early as you can. Do not put it off. Do not think this problem is going to go away by itself. They are not going to grow out of it. And even if they grow out of one symptom, it doesn't mean the illness is gone. So the hyperactivity, so this is another myth. Thank you for bringing this up and reminding me. So you look at the kid when they were 6 or 7, they're more hyper, they're moving a lot, okay? Once they go to middle school and high school, they're not as hyper, they're not jumping off the wall. High school kid is not gonna be climbing on the couches, okay? They don't do that. But that doesn't mean the illness is gone. The illness is there, it's manifesting in a different way. Or God forbid, the kid is already reaching out to marijuana to treat their own problems because they were never offered, they were never given a chance.
Mhm.
So if I have one piece of advice, treat as early as possible. Do not delay, do not put it off. And do not be scared. Do not be scared. You're not doing harm to your child if you put them on Adderall. It's the opposite. You are doing harm if you don't treat, if you prevent them and deprive them from getting a chance at better education, better grades, better self-esteem, and so on. There's a lot that goes into it.
Yeah. I'm sorry if I was smirking when I asked the question about like the one piece of advice, because I wasn't sure if you were going to say read the book. Yeah.
Well, of course, read the
Right.
book.
Of
The book
course.
is
Yeah.
available on Amazon. You can order it. You can Google it. You can Google my name and it will come up. Or you can Google, not Google it. I mean, on Amazon search, you can search by my name and it will come up. Or obviously by the book name, of course, also. So yeah, of course, read the book.
So, well, where can people find you if they want to work with you? Obviously, the book can be found on Amazon. You said you had a practice in Tampa, and I
Yes,
think
so
you do
my practice,
telemedicine too, right?
yes, my practice is virtual. It's virtual only. Our practice is called Focus ADHD. That's how much I love ADHD. Focus Psychiatry Clinic.com. So that's the website. You can go on the website, you read more about us and what we offer and what we do, our pricing, the insurances we accept, and all of that. You can also make an appointment directly there from the website. There is a way to contact us, and that will come to us as an email. There's our phone number listed there. So focuspsychiatryclinic.com. That would probably be the easiest way to find me.
Perfect. Is there anything else in closing that you'd like to share other than, or I might ask if, are you going to write another book since you already have one? Why don't you tell us the title of that
I
one?
I am thinking about it. So, like I said before in the beginning, that I'm really now interested in obesity medicine. Okay,
Mhm.
I really believe that obesity as an illness, as a disease, is becoming really the true epidemic right now,
Yeah.
and more specifically in children. So I'm thinking that my next book is going to be something related to obesity in children.
Mhm. Yeah, so we were talking about that, I think, before we started recording, and I was saying, yes, I need to have you come back so we can talk about this topic as well. But I'm very supportive of your book, and I definitely would probably like to read it myself. But it's a long queue of books I got to read, so got to have more time. But thank you. I mean, thank you so much for sharing your wisdom on our podcast today. And I hope you come back so you can tell us all about how obesity intersects with psychiatric diagnosis. Oh my God.
Absolutely. I would love to do that. It's
Yeah.
a passion of mine and it's a topic that's very dear to my heart.
Awesome. Yeah. So we will include all your information in the show notes, and everybody stay tuned next week for next week's episode. Thank you so much.
Thank you so much for having me.